keep her blood pressure up for almost 2 days now. Essentially, her numbers are looking really good.
Yeah, her oxygen and blood pressure looks pretty good.
Yes. So I'm hoping that we can maybe get her off the ventilator tomorrow. It's going to depend on how awake she can be for us and how interactive. And I haven't heard anything about. We have her on this brainwave machine, an EEG, just to make sure she's not having seizure activity. But I haven't heard anything from neurology to indicate that. And they usually call very promptly if there is seizure activity.
Okay.
So,
do you think that is that just something going on with everything else going on, or you think it has anything to do with her that benign tumor, or however you worded it?
It could possibly relate to the tumor. It doesn't look like the tumor, is growing. So, based on that, I wouldn't think that it would be causing her to have new onset seizures. So, if it were getting bigger or causing mass effect, things like that, then it might be more likely. But it's not impossible. What made us kind of worry about her having seizures is she was having these jerking movements kind of her arms, and it's hard to say. The sedative that we had her on yesterday, ketamine, can cause people to do kind of different and sometimes strange behaviors, and it's just an effect of the sedation.
I see.
So what we're hoping is that the sedation was essentially driving the abnormal movements, and she had some unequal pupils. Her eyes were uneven. Doesn't look like there's anything on the CAT.
Meaning like the size of them, or
yes,
how the location of
the
them?
pupil size.
Okay.
And that can be related to ketamine as well.
Okay.
Can cause that.
So since she's been on the EEG, you haven't had any alarm for anything, like no suspicious activity or anything?
No, sir.
Okay.
No, sir. And nothing that I've seen so far has indicated a seizure.
Okay. So
that's good news from our standpoint. We're trying as best as we can to get her. We switched her sedation today to a medication that's a little bit more gentle, Precedex, and it's less coma inducing, for lack of a better term. So we have her on that. Let's just see. Hey, Miss Cox, can you open your eyes for us?
she did a little while ago.
Hey, Miss Cox.
Hey, Mom, Dwayne's here. Yeah, she, maybe like an hour ago, I was talking with her, and she opened her eyes, and I was asking her some questions, and that's how I kind of found out her hand was right there, because she was moving her hand, like saying yes or no to whatever I asked her, and
Yes, sir.
she seemed a little attentive.
Yes, sir.
Mom, it's Dwayne. Dwayne's here. Okay, yeah, she just went like that.
Yeah.
They're taking care of you, Mom. You're getting better, okay?
Okay.
Yeah, she.
So what we'll do tomorrow morning is I'd hope to maybe try today, but it's getting late in the afternoon when we take the breathing. If we try to take the breathing tube out late in the afternoon, it can cause. There's fewer people here at night.
I see.
There's fewer doctors. Like during the day, it's us. If we need to call an anesthesiologist because it's difficult, there's plenty of anesthesia staff here. There's a lot of people to help if we need to put the tube back in. I think tomorrow morning, I think she's close, but we get her a little bit more awake. She sustains her eye opening as the sedation washes out, and then we try and see if we can pull the tube. So
Okay.
That's what I'm hopeful for in terms of the next 24 hours. I think that'll be the biggest thing that we can do.
Okay. Yeah, and Tessa mentioned, with everything that's been going on and like medication she's been on, I guess it kind of potentially put a shock to maybe her digestive system.
Yes.
So one of the goals is to her to go number 2.
Exactly. Get her
Okay.
passing gas and get her bowels moving again. The fentanyl can stop the bowels. When people are this sick, she was very, very sick the first day she got to us. That can, unfortunately, with a little bit of loss of blood flow, cause the bowels to be under stress. It doesn't look like they've, I don't want to, necrosis is the medical term, but it doesn't look like they've started dying based on the lactate level that we sent. But it's something to watch, and we're gonna supplement, her with the bowel regimen and everything to try to.
So is that just, trying to give her, I guess, food in liquid form and also maybe like some laxative stuff? Or?
Yes. We started some laxatives today, and I'll check and see. She hadn't had a bowel movement last time I checked, but we're holding her 2 feeds in the meantime.
Hi, Mom. It's okay. It's okay, Mom. It's okay. Relax, Mom.
Just try and relax, okay?
Hey, it's okay. You're getting better. It's okay.
We have a tube in your throat to kind of help you with breathing, okay?
It's okay.
We're
I'm
gonna
here.
try to take it out, but we need a little bit more time, okay?
It's okay, Mom. Just relax, okay? They're taking care of you. I'm here. Well, she has a tight grip, so that's good.
Can you give me a thumbs up with this hand?
Oh, yeah.
Okay, there we
Good
go.
job.
Good.
Good job.
I think we're close, but it's gonna be a little bit more time before we take the tube out, okay? You're doing great.
Can you go over how the bronch went? I think that was the last time I talked to you.
Absolutely. So we put it in, and what we were worried about was some airway bleeding. We really didn't see anything in the way of airway bleeding, putting it down her breathing tube. And we sent off some labs. She tested positive for not COVID, but a type of coronavirus that can sometimes cause severe respiratory infections. I don't think that's what caused her difficulty with oxygenation. I think she had a lot of fluid in her chest, and that was basically blocking gas exchange, blocking the body exchanging gas or oxygen for carbon dioxide. And so it looked like an infectious type bronch. You can see when we suction back the salt water, we sent it off to the lab. It had one cell type in there that points to bacterial or viral infection. So I think with one, it doesn't look like there's any bleeding. We don't think that this is a pulmonary vasculitis, and she does have this coronavirus, but it doesn't look like she has a bacterial lung infection or any other fungal infection, anything like that.
So that type of coronavirus is what you would say all this? I know she has a bunch of issues, but that's what you would maybe mostly pinpoint all this? Or
probably
there's a
not.
lot of things?
I think that a lot of this was all fluid. And when she got to us that morning, her oxygen dropped. We had so much trouble keeping it up, and we lost her blood pressure essentially, and that's when she had her cardiac arrest at about 7:30 in the morning.
So oxygen really low because, just her lungs, not fully...
There was fluid in her lungs.
Okay.
Fluid kind of at the small airway level, not in the big windpipe, but in the very, very small airways that was blocking basically air from coming in and out. So I think we're in a much better place. Her oxygenation, and that was why, especially over the past couple of days, we were keeping her so heavily sedated, because honestly, she was to the point where we were worried about needing to paralyze her. But it's a lot more stable now.
That's just because she was moving so much, or...
So when people, sorry, I just had to listen to that.
No, you're fine.
When people breathe, sometimes they can work against the ventilator, and when we give a paralytic which we did have to give her a paralytic that morning. That just helps, people not use their muscles against the vent. So that's why, but we didn't have to do it long term, which is a good thing.
Yeah, when I first saw her, it looked like it was really bad just with everything hooked up to her, but
Yeah.
everything, just me seeing oxygen and her blood pressure, makes me feel better after initially seeing her, so.
She's still very, very sick, still critically ill, but we're at least in a better place than we were, 2 days ago, for sure.
Hopefully the worst is behind us.
We'll keep supporting her. We're going to keep giving her antibiotics. There's not a clear infection, yet that we have, aside from that virus, the coronavirus. But we'll keep giving her antibiotics just in case. Tomorrow we'll try to get her off the ventilator. We're going to keep the dialysis machine overnight, continuous slow dialysis, and we'll talk to neurology and see if they have any other ideas. But hopefully tomorrow we can get her to bed.
So that coronavirus, is that something that maybe me or my wife or my 3-year-old should be worried about since she lived with us?
No, sir. It's not anything serious. It's in the family of the common cold.
I see. Oh, okay.
So rarely, in people who are immunocompromised, it's an issue and it can cause bad respiratory infection. But for most people, it's not an issue.
I got you.
So,
Okay. Yeah, I think that covers everything for me for now. I know it's probably a little while away, but just curious when she does get out, is there any like certain doctors that she's gonna need to go see like on her own time, or?
I think so. Well, at first, so I think she's going to be weak after all of this. We're not made to lay in bed for days and days, and so I think she'll probably need to go somewhere after discharge.
Physical therapy?
A type of, yes, a rehab facility. Of course, we'll have the physical therapists work with her once the tube's out and everything, and she can participate to see what she can do and what she can't do. But she'll probably have to see, have to go to a rehab facility. I think she should see a lung doctor for sure, because I know she has this reported history of COPD. We're not seeing it on the ventilator, but I think that she should have formal testing for that. And,
yeah, she smoked for a long time and still was continuing smoking, so that pisses me off, but it is what it is.
Yes, sir.
Yeah.
And she does have some spots in her lung too, some lung nodules. And there's a chance, especially with the smoking history, that those could be cancer. So she's going to need a biopsy for those spots on her lungs, but that is very far down the road.
I see.
That she's going to have to get a lot better before.
They're even able to do that?
Yes, sir.
Okay.
So it's probably not something we'll be able to do this hospital stay. But that's, she'll follow up with the lung doctor. She needs a biopsy there. She should see a primary care doctor. Hopefully she has some good primary care. And, her kidney doctor as well.
Yeah, that's fairly regular. As far as primary care, I know she has one. I'm not sure how often she goes, but okay. And whenever she does get discharged, that'll all be written down for us. Okay.
Yes.
Because there's a lot of stuff going on. So.
Yeah, absolutely. So we'll get guidance as to kind of follow up and everything she needs. But for now, it's kind of backing her out of this spot that she's in, and we're slowly getting her back.
So sorry.
Yes,
Sorry.
ma'am.
Sorry about that. Anything you can do.
All right, I'll be right there.
Okay. Yeah, if you have other things to do, I think I'm good with talking with you. Are you gonna be here the next few days, or you have time off? Or?
I'm off over the weekend, but I'm here otherwise.
Okay, so you'll be here Thursday, Friday?
Yes, sir.
Okay, all right, that
So I'll
works.
keep you up to date. Hopefully we can make a little bit more headway. It's very, it's a good sign that she can follow commands, give us thumbs up, things like that. So I'm very happy about that, and very happy with her oxygenation, and how good that's gotten. So,
Okay, so when you guys do take the ventilator off, will you immediately put her on the oxygen, or are you just gonna see
Yes.
how she, oh, okay.
We slowly kind of titrate down the oxygen as we can, as much as we can. So it'll be a slow kind of back off. But we'll try to get her, to the nasal prong so she doesn't have a big mask in her face.
I got you. Okay,
So,
okay, all right. Well, thanks again.
yes, sir. What other questions do you have?
Man, right now, I'm not really sure what else I should be asking, but
It's all good. We'll keep you up to date, and if anything changes, we'll let you know, okay?
okay. Well, thank you so much for all your care, and you guys have been great, so
Yes, sir.
much appreciated.
It's a good team here, so.
Yeah, it seems like it.
Absolutely. All right, well, thank you, sir.
Okay, all right, thank you.
Appreciate
We'll
it.
see you later.
This is sugar sugar.
Okay,
My name is Amira. I'm the night shift
Amira?
nurse. Yes,
Okay.
nice to meet you. We came in a little early, so
oh, it's fine.
because of the storm and all that, so they've been here for a couple of days. So
Yeah.
night shift was like, maybe this come early. So
Yeah.
I'll be taking care of your beautiful mom.
All right, thank you so much.
You're welcome.